Hey guys, Garrett McLaughlin here again with Dr. Riley, chiropractor here in the Nashville area, and glad to have him on for these videos. What we want to look at today is squat depth and specifically anatomy around the hips. I see a lot of people, especially in the fitness setting, having trouble with the squat as they come down, either not getting full depth, feeling pinching in the hip, or just having pain with the movement. So Dr. Riley right now is going to help us troubleshoot that and really look at a few things, really kind of break down that squat position, that squat movement, to help us uncover what the problem is.
Yeah, and there's obviously so many biomechanics and intricacies involved with the squat that lead to a lot of people coming in with complaints of either hip, low back, knee, ankle, you name it. It all can be related back to the squat. So we're going to go through 2 self-assessments today that you can kind of put yourself through and kind of give you at least some broad idea of something that you might need to work on. So we're actually going to go through 2 tests here that's actually going to be in one. One of the big things that might be helpful for you is having a mirror to assist you on the second part of this one, okay? So we're actually going to have Garrett go into what we call a quadruped position. We're going to measure what's called lateral hip mobility, okay? So one big thing with the squat is you need good depth, okay? So I'm going to have Garrett try to go his knees out as far as he can, okay? Okay, perfect. So he actually has really good lateral hip mobility. A lot of people can't typically get past this amount, but what we look for is if you can start to get your pelvis all the way down to the floor, then you have absolutely enough to be able to go really far into your squat, okay? So if you feel any big pinching here, anything like that, then we kind of suggest you usually go a little bit more in, but that's a good test for that. So the next one I'm going to have him do is, Garrett, go a little bit closer in with your knees. And the next thing I'm going to have him do is what we call the rock back test. So he's actually just going to take himself, and I want him to rock his back towards his feet. One big thing we kind of look for here is lumbar flexion, okay? And he's actually doing really good. He's able to maintain that throughout. So again, his squat depth would be pretty clean in this closed chain position, okay? So go ahead and come up. If you start to see that flexion in your low back, then we suggest playing around with the hips and the knees to see if you can make that more neutral in your spine.
I think that's a good point too, because a lot of people I see on a daily basis, and we hear the term butt wink, and you watch people as they go down to the bottom of the squat, and it's almost like their hips tuck under. I mean, I think that's what he's talking about, is getting that pelvis that rotates, which I think in the fitness setting, a lot of people we actually see that with. So if you're one of those people, if you look in the mirror and see that, run through these tests to see where you fit within this prone rock back.
All right, so for this next self-assessment, we're actually going to have Garrett do what's called an assisted squat. So Garrett, what I want you to do is go ahead and grab onto this. We want something that's relatively heavy and sturdy. So go ahead and grab on that and go into like a normal squat position for yourself. Okay, so I'm going to have him go ahead and hold on to that and let the weight take him down perfectly. Yep. And then what I want you to do, Garrett, is go ahead and just let go of that weighted object and go ahead and come right back up into your squat. So one big thing we kind of look for here is obviously how does it look, okay? So again, if you do have a mirror, go ahead and use that as your assessment. You want a nice neutral spine as you descend down. That's one of the things that this weighted object kind of helps you with, is when you let go, if you're able to have that stability to stay in that position and rise, then perfect. You're in a great position for squatting here. Okay, Garrett, do you want to add anything to that?
No, I think that's a good point about holding on to something, because a lot of people that I see, especially with squats, and I think too quickly add weight onto the back squat, come down and they're in this really flexed position, hips are tucking under. So I always think taking a step back too and really getting the basics is so essential, which is what he pointed out in this video here today. So
absolutely.
All right, guys, so thank you for checking out the video today. Again, quick question for Dr. Riley. What types of issues do you usually see with the squat? What kinds of orthopedic issues will be created from poor squat form?
Excellent question. Big things that come in with that is any type of low back pain, so extension, flexion based, hip impingement as well, any mechanical knee pain. And when we say mechanical pain, we're talking about anything that we could possibly modify in a way to make it a little bit better. So we tend to look for that when those patients come in with that. So a big thing is with these self-assessments, it's a good guide to kind of get you a start. Next big thing is kind of working with guys like Garrett in the gym, asking them questions like, what can we do to modify our pain if we do have that? And if we can't simply break through it, then you need to seek out a functional movement specialist who can get that assessed for you and get it treated. Okay, Garrett?
Dr. Riley, thanks for your time today, guys. If any questions or comments, feel free to leave them below. Let me know if you need any assistance, or I could forward you Dr. Riley's information. But thank you for checking out the video today.